BlackFULLness app, though, was developed with a grant from NIH and their SBIR vehicle, and developed at Spelman. Our chief psychologist, Dr. Natalie Watson-Singleton, is a professor there, associate professor in the psychology department at Spelman. And it really came from a grant from NIH that was asking the question about whether or not a mobile health app could help reduce stress in the African American population. And so it went through randomized controlled trials, and then my co-founder and I came along to really figure out, how do we make sure that this doesn't end up as shelfware, right? How do we make sure that we can take it into the world and we can really kind of lean into it in new and interesting ways? And part of that was, how do we take the app and not only have it be about the app, but have it be about the experience of the app? And so in addition to having the app, we offer experiences like our self-care lounge. We do digital virtual experiences as well. We have a gratitude journal that's coming out in January. Our work really is to meet people where they are and give them the tools. We're talking about something, like I said before, simple that you can really integrate into your life that has long-lasting effects. It's about the consistency factor, right? You can't get a six-pack with one sit-up, right? Like, I wish I could. I wish I'd have one by now, right? But so for us, we're really talking about the consistency. You might not have 30 minutes to meditate every day, but you've got 5 minutes. I promise you've got 5 minutes. You could spend 5 minutes less time on Instagram, 5 minutes less time on Facebook, and spend a little bit of time with really tending to your mental health. And that's really what we're about, is making sure that we spend some time in the tending to our mental health. And the QR code's there. You can download the app. It's available free of charge. It won't always be free. My big hairy goal is to have all people supported by it, all the Black people in particular, to be supported by it. But our investors have other ideas. And so we want to make sure that it is available to folks. So if you download it before the paywall comes up, you'll get it for a year for free, right? And so make sure that you get yourself in there. In general, what we're also doing is really focused on the research, because in so many cases, African Americans are being also left out of the research when it comes to talking about general health disparities, really, but specifically around mental health. And one of the issues is us being able to see ourselves in it, right? If there's places where it doesn't seem like there's anyone who looks like us or sounds like us, or may have a similar lived experience, it's hard for us to resonate with it. And I spent a lot of time in that work, a lot of time just, okay, I'm gonna look past the fact that nobody here looks like me, and I'm gonna get what I came for, right? I'm gonna get this wisdom, I'm gonna get this knowledge, I'm gonna get this lesson, and then we're gonna figure out how to translate it. When it comes to the research, we're really making sure that we continue to have it present in as many things as possible. So the work at Florida State is about helping reduce binge drinking in Black male athletes. The work we're doing, thank you to Dr. Kim Rhodes and her love and belief of us. And we're working with her on telomere lengths with a 12-week intervention for cancer survivors, right? We're also doing some work, yes, thank you, thank you, Z. The work we're doing, yes, exactly, with some Highland work at Emory University around PTSD and Black mothers, right? We talk about the Black maternal mortality rate is a big conversation right now. We want to see Black maternal vitality, right? We want to see this new idea of how we can live more expansively. And then, so that's another important factor in what we're offering. But for us, it's about the day-to-day. How do I really just manage my life? And not only manage my life, but how do I thrive, right? Like, I'm not here to burn out, I'm here to burn it up. I'm here to live my best life, right? I'm here to bring it. So how do we really have an opportunity to live and lean into that in new ways?